Hello, everyone, and good afternoon. Some people continue to join, but I think we'll go ahead and get started out of respect for everyone's time. I'm Emily Campbell. I'm the Chief Operating Officer at the Center for Community Solutions, and in some ways, I'll be your master of ceremonies today. A couple of quick housekeeping items that have been posted in the chat. A copy of the recording of this webinar will be available later today or early tomorrow. It's always the first question we get. If you have another question, please feel welcome to post it into the chat or into the question and answer boxes, and we'll be sure to share it with our presenters here this afternoon. And also, closed captioning is available. Just select the button that says Show Caption in order to activate. So we'll give it just another moment or two as folks continue to join, and then we will get started with the meat of the program. All right, it seems like the number of folks joining has slowed down for just a moment. Thank you all so much for joining us this afternoon for some new information about community conditions in Stark County. Again, I'm Emily Campbell from the Center for Community Solutions, joined by my colleague, Dr. Susanna Thies, who is a research fellow at the Center for Community Solutions. But before we really get started, we wanted to turn it over to some of our partners in this work, starting with Amy Krebs, who is Vice President of Grants and Community Initiatives with the Stark Community Foundation. Amy?
Thanks, Emily, and good afternoon, everyone. We appreciate you taking time to join us on today's webinar about the 2023 Stark County Community Assessment. As Emily will mention, and Susanna, throughout the presentation, this report is an update to a report that was last released in 2019. I want to quickly mention that in the 2019 report, one of the data sets that stood out was around the high rates of child poverty. And in response, Stark Community Foundation developed the Protecting Stark's Future initiative, and that initiative continues today. The request for proposals was released on our website last week, and the application opens today, and it's open through October 18th. We are interested in efforts that address child poverty at the root level, including associated issues that you'll hear more about today, including chronic absenteeism, literacy, and activities that look at increasing earnings of families. And you can find much more information on our website, including funding levels. I should also note that you'll see in the application, it also provides information around two community programs: Strengthening Stark, primarily focused on economic development, and the Stark County Neighborhood Partnership Program, focused on neighborhood associations and engaging residents throughout Stark County. These are two very important efforts that very much complement this work. And if you aren't familiar with these two programs, we would encourage you to learn more about them as well. Finally, before I turn it over to our friends at the United Way, I just want to recognize our partnership with the United Way and with the Center for Community Solutions. And just the fact that we're in this space, we're looking, as I know you are as well, and having a better understanding of this data. From a funding perspective, it certainly helps inform our charitable investments in the community. And we look forward to working alongside of each of you. So with that, I will turn it over to Angela Perisik with the United Way.
Thank you, Amy, and welcome everyone. Thank you for joining us. We're excited to release this assessment and really grateful for the partnership with Stark Community Foundation and Center for Community Solutions. One of the things that we find exciting about this updated assessment is this will really be the first look with some data that shows implications that COVID had on our community. So we think that you will find that interesting to see as well. But with that, I just want to say thank you and for being here. And I'll turn it back over to Emily.
Great. Thank you, Angela, and thank you, Amy. This is a powerful report, a powerful piece of information that we have collected and are so pleased to share with you today. And even more powerful because we have two important institutions in the community that have joined together in order to jointly release this document that we hope will be a resource for many of you. As Amy mentioned, the Stark County Community Assessment, the 2023 edition, is an update from a report that was published in 2019. It contains a lot of the similar information to what that first document had. And we know that that data that was contained in that document generated a lot of conversation about issues facing people in the community, about community conditions, and about how to move Stark County forward. So we're so pleased to have the opportunity to share with you today some of the high-level highlights of some of the data that's contained in this new assessment. Now, as it says in the introduction to the report, to say that much has occurred since the release of the last Stark County Community Assessment is an understatement. Not only did we have the COVID-19 pandemic, but we also witnessed a national reawakening to issues related to systemic racism and to equity more generally. And so this document is the first comprehensive compilation of data on conditions in Stark County that has been pulled together since the beginning of the pandemic. I want to note that much of the data was collected in 2021. We know that that was a time when many schools maintained remote learning, emergency pandemic assistance was still in place for families, and vaccination for COVID-19 was less widespread, but it still provides the most complete snapshot of data on community conditions since the beginning of the COVID-19 global pandemic. So here on your screen, you can see the 6 categories of data and information that we have pulled together. These are not meant to be an exhaustive compilation of all the data about Stark County, but a curated set of indicators to inform decision-making. The specific indicators were selected based on their relationship to key communities. Data availability was a serious issue for some things that we would have loved to take a look at. They were also selected based on reliability and updating of data, and based on feedback provided by local leaders. Susanna and I had the opportunity to share some preliminary findings with the Stark County Family Council a few weeks ago, and see that many of you have joined this afternoon again. So thank you for providing some feedback that enabled us to dig in a little bit more and understand some of the implications of some of the data that we are seeing here. So just as a reminder, this is being recorded. We will be posting the recording this afternoon or early tomorrow. If you have a question, please type it in the chat, or in the Q&A is an even better place to make sure that we can see it. I see that many people are introducing themselves in the chat, which is wonderful. We have over 170 people that have joined this webinar. So thank you for joining us this afternoon. With that, I want to turn it over to my colleague from the Center for Community Solutions, Dr. Susanna Thies, who was really responsible for pulling together much of the information and who will walk through with us much of the data. Once she is done with that, I'll jump back in to talk a little bit about poverty data, which is my area of expertise, and some information that was released by the Census Bureau just last Thursday that we very quickly took a look at. And then we hope to leave ample time for questions. So please feel welcome as you are listening to type your questions into the Q&A or into the chat, and we will try to get to as many as we can. So with that, let me turn it over to Susanna.
Thank you, Emily. Thank you all for being here. Happy Monday. Good morning. It's not morning, it's afternoon, but it's definitely Monday. I'm so glad that you all are here. Judging by the fact that there is 170 and counting of you, there is definitely a huge hunger and need for data on your community. And I really hope that this report can help to update the last report, but also maybe provide some new insight into things going on. So with that being said, let's jump right in. So here we have Stark County, the geography that we're talking about. Stark is the seventh largest county in the state. It has 8 cities, 17 townships, and 17 school districts. And there are about 374,000 people living in Stark County. We have the age distribution of Stark County here. Older adults outnumber children in the county, and that does follow national and state trends here. The larger cities are usually about younger than the county as a whole. And I just wanted to take a moment to do a shameless plug for another project that the Center for Community Solutions is working on. The Stark County Age Friendly Assessment will be coming out, I believe, next month. So just keep your eyes peeled for that assessment coming out soon. Everybody loves a good map. So we created 4 of them for the different racial and ethnic groups in Stark County. We have a map for white residents, Black residents, Hispanic and Latino residents of any race, and then Asian residents as well. And just a note, demographics usually don't change that much from year to year. So these demographics probably have not changed much since the last assessment. So this is a new section that we added based on some feedback from Family Council and other community leaders, just that there is an interest in data on immigrant and refugees in Stark County. So we decided to add that portion to this report here as well. So a little over 2% of the population of Stark County is classified as foreign born, which means that they're not born in the United States or any of the United States territories. Of those who were not born in the United States, 58% have become U.S. citizens. And most of the immigrants, as you can see there from the second pie chart at the bottom, they were born in Europe or Asia, with another large group being born in Latin America. And about 3% of households speak a language other than English at home. And for refugees, we were only able to get state level data. So that's what we have in the report. So in Ohio, about 57% came from the Democratic Republic of Congo, followed by 12% from Syria. And then there is a very large table in the report with that full listing of where every refugee has come from. So take a look at the report to get that full list.
Susanna, while you're pausing, if you can move a little closer to the microphone, that would be
Yes.
great. Thank you.
I'm so sorry.
Oh, that's much better. Thank you.
Can you hear me better?
Yes, much better. Thank
Okay,
you.
I'm so sorry. All right, so housing in Stark County. So married couples had about 3 in 5 households, but Stark County actually has slightly higher rates of single parent households at around 10% for male head of households and 30% for female. Evictions were up slightly compared to the last assessment to 5.6%, and I believe they were either 5.2 or 5.4 for that the last assessment, but that is still lower than the state average. Lead poisoning is lower than last assessment, which is great, and Alliance actually fell by about 2 percentage points, but as you can see by that chart, they're still over double from what the Stark County normally is. Unaffordable housing, which is spending 30% or more of your income on housing and related costs, also dropped by about 2% for renters and homeowners since the last assessment. However, the average for Canton and Massillon continues to be higher than both the county and the state. When housing is taking such a large part of income, there isn't a lot left over to pay for food or transportation or healthcare or kind of the other costs that come along with living. So it's great that it's down about 2%, but Alliance and Canton, you can see here, are at 29 and 34. So about 83% of Stark County residents drive alone to work. And as of 2021, so emphasis that this is 2021 data, 7.5% work from home. So I'm not sure if that would be higher or lower now. 2021, we were kind of in the thick of COVID, so there may have been more people staying home, but I know now a lot of workplaces are hybrid as well. So about 3% of Stark County residents do not own a vehicle, but less than 1% take public transit to work. And we heard from focus groups and through our a survey that there aren't a lot of options for residents who don't have cars. And some residents mentioned sidewalks being in disrepair and not handicap accessible. So even walking places can be difficult for some people. And these focus groups were conducted for another project that we're doing in Stark County, but it is still very applicable to this one as well. So the education data is kind of where things get weird, to say the least. You definitely see the effects of COVID through this education data, but we'll start here with the educational attainment of the county. Stark County has an unusually high percentage of adults who have no education beyond high school. So only 23% of residents have a bachelor's degree or higher, and earning potential and economic independence is very closely tied to educational attainment. In Stark County, of those who are living in poverty, 25% did not have a high school education, compared to 3% who had a bachelor's education. So this is clear. All of the data is very clear that having at least a high school education means a lot for your health, for your life. And those without a high school education have a much lower median income, around $20,000, and make almost $2 million less in their lifetime compared to someone with a bachelor's degree. So school enrollment, school suspensions, and the percent of students who are eligible for free and reduced lunch all decreased from the last assessment. And there was also a drop of about 1,000 children enrolled in publicly funded daycare. So the question becomes, where are these children? And that question continues when we begin to look at chronic absenteeism. And when speaking to some of you guys, the community leaders and at Family Council, these numbers were not at all surprising to you. There were mentions of increase in school violence that made some students and their families apprehensive to attend school. There's been a move for some families to homeschool their children or pursue other opportunities like charter schools. And when we look at geographic mobility, it really has not changed much in the past few years. So these kids are here, they're still in the community, but they just aren't being counted in the traditional sense. And when you look at this chart for chronic absenteeism, almost half of Canton City School students are considered chronically absent, which that is very high. So here we have some of the readiness scores, some of the standardized scores, and of course it probably comes at no surprise that these are a lot lower than the last assessment. COVID had an ample effect on our education system and the students that are in our educational system. So I'm sure that that is primarily responsible for the big change in a lot of these scores. And except for Canton and Massillon, all of the districts in Stark County had 4-year graduation rates that were above the state average of 87%, with most of those having almost 100%. So in Stark County, 6.2% of the population are uninsured. And we also have a chart there lining out percent uninsured by age. And you can see it's kind of a nice bell curve, I guess. The more younger adult, middle age, there's higher rates of uninsured. And the younger you are and the older you are, there's lower rates of being uninsured. 16.9% of Stark County residents report that they were in poor or fair health. And then Alzheimer's disease was another point that some community leaders wanted to see in this report. And we found that it affects about 11% of older adults in Stark County, and that is expected to grow by 14% by 2025. So that's kind of a big increase that it's expected to grow by. And then leading causes of death are diseases of the heart, malignant neoplasms, which are tumors, and then COVID-19. And then in the top right of your screen, we have some ratios for providers. So it is the number of residents per one provider. And all of those ratios are better than the state average, which is great. Here we have some health behaviors. The estimated drug overdoses really peaked there in 2016 and then have fell and remained relatively steady. For 2022, we did have to do some calculations because the full numbers have not been released yet. So what we calculated was about 600, which is a little lower than the previous year, 2021. We included a section about ACEs, this report. It seems to be that there is a lot of data that people want to use for ACEs. It's kind of becoming an up and coming variable that communities want to look at. So we did pull some ACEs data there as well. And then for health behaviors, you can see insufficient sleep. About 37% of residents say that they do not get enough sleep. Binge drinking is about 15%, smoking is 20%, and then physical inactivity is 27%. So Stark County's unemployment rate is 4.9%, with Canton's being over 10%. So it's over double than that. And then we looked at economically disengaged youth or disengaged youth, and that is considered individuals between the ages of 16 and 19 who are not in school and not working. And disengaged youth rates tend to be very closely linked with business cycles and usually follow the trend of the economy. So these have definitely increased a lot since the last assessment. And Canton's youth is more than 3 times what the county is. I suspect that COVID had a lot to do with that. Young people may have chosen not to pursue higher education because at the time of this data, which was 2021, a lot of campuses may have been virtual and maybe students did not want to have to pay the exorbitant college prices to sit on a computer at home. And many colleges and universities were still at least partially virtual. So that could have at least contributed to this. The very surprising data point to me kind of in this entire assessment was that 13.5% of households do not have an internet subscription. And when we break this down by income, 1 in 3 households making less than $20,000 do not have an internet subscription. And that is a very, very high number. This was very surprising to me. I know that there are parts of Stark County that are rural, so that may be kind of skewing this data. So this number was just very, very high for me. The median household income in 2021 for Stark County was $58,170. That median household income is lower than the state's average and also did not keep up with inflation. I think it would have to be over $62,000 to keep up with inflation. And I will turn it over to our resident expert in poverty, Emily Campbell.
Great, thank you, Susanna. I see that there are a few questions coming in through the Q&A. Please feel welcome to post your questions there. We'll answer those in just a moment when we finish with our slides and the presentation. So a little bit about poverty. You know, the 2019 Stark County Community Assessment really shone a bright light on issues of poverty and especially child poverty that have influenced some of the work of United Way and Stark Community Foundation since that time. So of course, we wanted to take a look at that data again and see how things may have changed or where the community is today. In 2021, overall, 13.4% of Stark County residents lived in poverty. While there are people living in poverty in every corner of the county, they aren't spread evenly. In the report, you'll see poverty for each municipality, and here on the screen, you see a map showing poverty rate by census tract. The darker colors are places where a greater proportion or a greater share of people are living in poverty, so poverty rate is higher. It's probably in the places that you would expect for those of you that are working every day in the community. Canton, Alliance, Massillon, Sandy Township, and Lexington Township all have poverty rates which are above the county average. So have poverty rates that are greater than that 13.4%. Every other municipality's poverty rate is below that county average. And if we can go to the next slide, thanks, Susanna. And as in other communities and across the state, we see racial disparities in the share of people living in poverty. In Stark County, Black residents and Hispanic or Latinx residents of any race are more than 3 times more likely to be living in poverty rate than white residents. So the poverty rate for Black or African American residents or for Hispanic and Latino residents is 3 times that 10.5% that we see there for white residents. We also know that the younger you are, the more likely you are to be living in poverty. Now, this is partly because of the way poverty is counted and some policy decisions. You know, the reason that poverty for older adults is so low is Social Security. Social Security counts as income when calculating poverty, where many of the things that help families like food assistance, housing assistance, the Medicaid coverage for health insurance, those things don't count as income. And so they're not taken into consideration when we're looking at poverty rate. But some brand new data that was released just last week gives us reasons for hope. Nationwide, poverty rate for Black Americans was at the lowest ever recorded in 2022. And we see a slight closing of racial and gender income gaps. Community Solutions is going to be analyzing the data and looking much more carefully, but things seem to be moving in the right direction. And if we go to the next slide, you'll be able to see that poverty rate for children in Canton is also better than it was a few years ago. So when we put out the initial report, Canton had the dubious distinction for having the highest estimated child poverty rate of any city in the country with population over 65,000 people. You can see it there, those high rates, over 56% of children in Canton living in poverty. And then something kind of strange happens with the data and the 1-year poverty estimates. We didn't have data in 2020, thanks to the pandemic and some collection issues. We weren't able to have an estimate for 2020. And when the 2021 data was released about a year ago, we saw this enormous drop in child poverty in Canton, you know, falling from 56.9% to 35.4%. We think that it's a data anomaly rather than an indication of conditions within the community, unfortunately. There was some strange things underlying the data, a surprisingly high number reported of married couple families, much higher than it had been just a few years ago, and kind of out of the norm of what we were seeing. And married couple families are less likely to be living in poverty than single parent household families. So we think that was what was driving this low estimate. We got new data, updated data, 1-year estimates for 2022. They were released on Thursday, and you can see there that the child poverty rate in Canton, the estimate is now 43.5%. So in between what it had been a few years ago, but more in line with the general overall trend in the last decade or so. So again, we think that that very low number for 2021 was a data anomaly, not a reflection of actual conditions facing families. I will say that for most of the report, we utilize the 5-year estimates because we have those for smaller geographies and they're much more reliable. You can see some of the ups and downs every year in the 1-year data that is presented here. And so what we're looking for are general overall trends for indications of what may be happening in the community. I see here a question that's relevant for right now, which is a question about tax credits. So tax credits do not count in the calculations of poverty that you're seeing here. Stimulus payments do. Additional unemployment insurance does count. So some of those things were impacting families in 2021. But the supplemental poverty measure, which unfortunately we don't have for smaller areas, anything smaller than state, showed the impact of the enhanced child tax credit that was in place during 2021. When that went away, we saw the child poverty rate, according to the supplemental poverty number, double. So that brings us to the end of our presentation. We posted in the chat where you'll be able to find the report at the end of the webinar. This is just a very quick overview of some of the high-level highlights, but contained within those pages, you will find much more information about those 6 topic areas. It's a 42-page report filled with all kinds of charts, graphs, data, and information. I would definitely encourage you to share your questions here, either in the chat or in the Q&A, and I see a few that we'll get to in a moment, or also feel welcome to reach out to us at the Center for Community Solutions or those from Stark Community Foundation and United Way of Greater Stark County if you have any additional questions. All right, moving to the Q&A. I see one that came in. As this is mid-COVID, how did eviction controls impact the number? So the eviction data that's contained in the report was actually collected pre-COVID. The source that we use, the Eviction Lab, has not been updated yet. And so that data is pre-COVID. However, data that we see from other communities in Ohio that have been updated do show a reduction in evictions since the beginning of the pandemic, and that it fell dramatically during the pandemic when there were eviction moratoriums, and even now they remain lower. In Cincinnati, it's 3% lower than during the pandemic. And in Cleveland, evictions have fallen by 20%. But in Cleveland, we have also implemented right to counsel legislation, which gives every person who is facing an eviction, every tenant, the right to have legal representation through legal aid and other partners during their eviction hearings. And we're seeing that, the impact of that. All right, answered that live. Great. A second question, on the education slide showing proficiency, does that include private and charter schools or just public? It includes just the public school districts. When we see information for the entire county, it does include children from that county who may be in private and charter schools if they report to the state, which I think all of them have to now. That wasn't always the case. But the data for the specific school districts are just children that are attending those public school districts. If I can get a nod from Susanna to make sure that that is accurate, great. Thank you. Thank you. All right, another question from the chat. Where does Canton now rank amongst communities the same size across the country? We need to crunch those numbers. As I mentioned, the data was released on Thursday and we turned it around as quickly as we can. You know, we can go and look and see where those rankings are. Canton remains a high poverty city. Among cities in the US, as several places in Ohio remain high poverty cities, but it is not that sort of dubious worst spot that it was a few years ago. I will pause there and see if there are any other questions. Oh, here we go. Yeah. Question, how do you gather the data that identifies the percentages of disengaged youth? So that data source is the US Census Bureau's American Community Survey. It's an annual survey conducted by the Census Bureau for communities across the country. And it looks at the number of youth who are not in school and not working. And so that is the data source for the disengaged youth information. I will say that we saw disengaged youth spike during the pandemic, and it was especially high in actually some more affluent communities where we didn't expect to see it. What we think was happening was gap year students. So they had graduated from high school, had delayed matriculating to higher education for a year or more. We're living with mom and dad, probably not working. But the people that we're really concerned about looking at some of this are those youth who have not begun their career and maybe have missed the transition or the connection between leaving K-12 and moving into post-secondary education or the labor force. So that is where the data come from there. All right, thank you. Keep the answers coming. So the percentage of disengaged youth in Massillon seems to have been cut in half since the last report. Is there a reason? Short answer is, I don't know. we'll have to look at the data and see if there are some indications that we might be able to look at to see what that would be. But you know, one of the things that I would suggest is those of you who do work in those communities probably have a pretty good pulse on what's happening in communities and can help us answer that question. Because you know, one of the things about this data is that sometimes it's data without a lot of context. And those of you who are working in the community can tell us much more about what you're seeing and experiencing and hearing from those that you're working on to help us understand a little bit better what some of the data are telling us. So I'm looking forward to many conversations about what you all are seeing as you go through. Okay, next question. How do the results of the community assessment impact or work in conjunction with the Stark County Community Health Assessment process, particularly in regard to access to mental health and behavioral health care? That is a great question. So the two processes of assessment were very different. There are a few data sources that overlap, but as I'm sure you can imagine, the Stark County Community Health Assessment went much deeper into issues of health and well-being than this particular report does. So what I would suggest is that if you're looking for data about overall community conditions, you know, this report that we're sharing with you today is a great source. If you really want to dig in on data on health and mental health and behavioral health, I would certainly take a look at the information that's through the community health assessment, because they've just had the opportunity to dig a lot more deeply. And that goes for data about education. I know that in Stark County, the Stark Education Initiative, I think is the name of it, has a lot of great data and information about education and what's happening in different communities throughout Stark County. Okay, assuming on the full report there's a section for diagnosis and increasing, if so, is that information given by the local hospitals as well? I think this question may relate to some of the data on health conditions. A lot of that data comes from the Center for Disease Control and Prevention and the information that they are collecting. And so I'd suggest, you know, if you have a specific question about a specific data point, we can try and answer it here, but that's where most of the information comes from. And the CDC does collect from public health departments, from hospitals. They have a very robust data collection arm, as I'm sure you would expect. Brian says that he would credit the Legacy Project and 708. I think that's in response to the reduction in the share of disengaged youth in Massillon. Thank you for that. Okay, I'm going to go back over to the chat here, and then we'll go back again to the questions. With this data being from 2021 and unfortunately health outcomes worsening, how can we garner more recent data for county initiatives? So the more recent community health needs assessment is a great place to get some more recent data. I would also encourage everyone to check out data that's provided by the health department. Y'all have a great health department in Stark County, as well as information from the CDC and from the Ohio Department of Health. All of these places have made health data much more readily accessible than it was in past years. And actually, for those of you who are intimately familiar with every part of the previous report, you'll notice that the health section has been increased in this report, just thanks in large part to the availability of new data and information. And about the sort of time frame, while much of the data that comes from the U.S. Census Bureau, or all of it, with the exception of these one-year child poverty estimates, was collected in 2021, we've included the most up-to-date reliable data that we have. So for example, just last week, the Ohio Department of Education released their state report card data for all the school districts. We went and revised that section of the report to encompass the most up-to-date data and information at the time of publication. So some of it is a little more up-to-date, 2022, 2023 school year, or most of it from, some of it from 2022, we've used the most up-to-date and reliable that's available. So it's the best that we have at this time for all of the indicators. All right, is there data that indicates how many families receive support services or barriers preventing receiving services? No need to apologize for stepping away for a minute, Erica. We did not mention it. There is a little bit of data about SNAP recipients, but that's about it when we're talking about receiving supportive services. The other place that we have a little bit of data about services comes when we are looking at early childhood education and high quality preschool slots or high quality early care and education slots in the step up to quality star rating system. So that is not something that we dig into deeply in this particular report, but I'll tell you that it's something that's of particular interest to the Center for Community Solutions and something that our organization, our researchers, and our policy folks are thinking about every day and taking a look at. And so hopefully we'll have some more information out about that soon, but we can have a whole offline conversation about what some of the data seem to be indicating across the state and what some of the barriers may be. Thank you for that question. We can talk about it all day. And then, another question that I see here, will this be followed up with recommendations for change in Stark County? So I actually want to see if maybe one of our partners from United Way or from the Stark Community Foundation want to talk about this a little bit. This data and this report is meant to be information that can underpin a lot of those discussions about where to devote resources, where progress may be heading in the right direction, where it may be heading in the wrong direction. But let me pause here and see if Angela or Amy want to comment about some of the sort of next steps.
Thanks, Emily. I'll chime in here briefly from Stark Communities Foundation's perspective, particularly with competitive grants. We have included on many of our various funding opportunities a question around data. So when a request is made to the foundation, we're looking for, the rationale of the need or the opportunity. So this publication can certainly serve as that. So for those organizations, those nonprofits on the front lines, all the more seeing the needs and opportunities in Stark County, to be able to pinpoint to these data tables that get your attention, we ask that you bring that to our attention and how your organization can all the more address that need. We do have initiatives at the foundation as well, like the Protecting Stark's Future initiative that I mentioned. And in that report, you'll see that there are recommendations, but we really look to the nonprofits on the ground to tell us as well the needs that they are seeing.
Thanks, Amy, for jumping in. And then a comment that's come through from Brian Bowman. Timothy Sarko is the data dissemination specialist at Census for this area. An event can be put together to educate on how to pull the data from Census and the reports he can create. Working through the congressional office, this could be coordinated. I think that would be a great event because we have compiled and collected data from Census and other sources in this report, but we have limited space and limited capacity and have not tried to cover everything, but hit some of the highlights and go a little bit deeper in some areas. But the U.S. Census Bureau has a wealth of data and information about communities that can be sliced and diced all kinds of different ways. And so, for those who are interested in learning more, that sounds like a great suggestion. Okay. Is there any additional information available regarding the access to parks and recreation and the impact on the local economy and overall health for the community? So we don't have additional information in the report about parks and recreation, but I can tell you that this is an area of study that's part of the age-friendly Stark assessment that is underway right now and should be released in the next month or so. Now, of course, that assessment is looking primarily at the needs and resources available to older adults in the community. But often what's good for older adults is good for people of all ages. And so there will, recreation and parks is one of the 8 domains of that assessment. And so there will be more information coming out in the coming months about that. But an issue, thank you for bringing it up. It's something that, we haven't had good data about for a while, and something that people are increasingly talking about as we think about place-based solutions, about health and wellness in a more holistic way, and the importance of recreation opportunities for people of all ages, not the least of which are children and youth. So thank you for that comment. I want to give pause for a moment. We've run through a bunch of questions and a bunch of information to see if folks have additional things that they're wondering about right now. And while you're thinking of your last minute questions, you can see on the screen what the cover of the report looks like. It can be accessed, and we'll put the chat, or we'll put the direct link in the chat yet again. It is up and ready for you to peruse. And that you can take a look at it, see if it confirms or denies what you're seeing in your community, and think about what some of these indicators may mean for conditions in the community, for the people who are living in Stark County, as well as for the many initiatives that you are all engaged in. And also thank you to my colleague, Ebony Thornton, who is working behind the scenes to make sure our tech works well. A copy of the recording will be available later today. All right, another question has come in. There is some information about ALICE households. Can you speak to the variance of the poverty level and ALICE level? Is the gap getting bigger with inflation? So the poverty levels are updated every year for inflation, and that's it. They've been updated every year for inflation since the 1960s when they were put in place. So as inflation increases, the poverty thresholds increase. So that's baked into the numbers. In terms of the ALICE level, ALICE stands for, let's see if I can remember, Asset Limited Income Constrained Employed, and really looks not at those official poverty thresholds that the federal government sets, but at a more holistic view of what families need to get by in a community. So it takes into account many things that the official poverty statistics do not. Any measure of self-sufficiency, of living wage, ALICE, whatever you may call it, those income levels that families need are always higher than the poverty threshold. And it's because the poverty threshold is very carefully defined. So the inflation is taken into account in both the measures, so that's not really it. Really what the gap between ALICE and the official poverty statistics show is the inadequacy of official poverty statistics. So poverty, the federal government uses a measure that was put in place in the 1960s. It takes the cost of food and multiplies it by 3, and then has been updated for inflation and nothing else. In the 1960s, food was about 1/3 of a low-income family's budget. Today, that's no longer true. Housing costs, healthcare costs, childcare costs make up a much larger share of a low-income family's spending than food does, but it's what we have and what we have to use for those poverty statistics. And the reason that we see so many programs where the eligibility is set at 200% of the federal poverty level, or 138%, or 300%, is the recognition that the poverty threshold doesn't accurately reflect what a family would need to get by without other help. Thanks for that question. One of my favorite topics to talk about. And we have a note here about chronic absenteeism rates. And, Susanna, can you give a definition of chronic absenteeism and how that's defined? Because I know that you pulled that information together.
I can, just give me 1 minute.
I know I'm putting her on the spot. We can still see your screen. So according to the official definitions, chronic absenteeism is missing 10% or more of the academic year for any reason. It counts both excused and unexcused absences. I know I put you on the spot. Sorry, Susanna. And takes a look at instructional hours as well. Chronic absenteeism across the state has increased substantially since before the pandemic. You know, there's been a lot of upheaval. Anyone that has school-aged children knows the upheaval that we've experienced in education. The data that we have reported in the report is from 2022 to 2023 school year. So the school year that ended in the spring. So less about absence due to COVID and more about children not attending for other reasons.
Yeah,
And that's
so
what
just
we're
kind of
doing.
to add on to that, thank you for answering. It's
Sure.
hard managing so many screens and, you know, everyone knows, I'm sure. So yeah, 10%. Ohio recently moved, or I guess in the past 10 years, to calamity hours. So now it's measured in hours instead of days. So that was a change, I think, in 2014. And something that we noticed when we replaced the 2021-2022 data with the 2022 to 2023 data is some of the schools flipped, and some of the schools that had higher rates now have very low rates. So we suspect that there may be some inconsistencies in reporting, either on the school district level or on a building level, because in order to be considered chronically absent, the parent has to be notified. So you'll just notice some interesting things in the data there that may just be from data inconsistencies there.
Thank you, Susanna. So while Susanna was talking, I was able to take a look at some other data that I have here to answer a question that had been asked before, but a question about Canton previously ranked as #1 in child poverty in cities of a similar size. What is our ranking now? All right, so looking at the data that was just released on Thursday, among all cities with populations over 65,000, so large cities, smaller cities, all across the country, Canton now ranks 10th. And so, you know, the smaller the geography, the larger the margins of error, and things sort of bop around. So Canton's child poverty rate, according to the latest estimates, was 43.5%. The next closest was Hartford, Connecticut at 44.4%. City in California at 45.3%. So all very close and within all the margins of error. But according to the latest data, Canton ranks 10th out of 640 cities in the country that have population that's 65,000 or above. So, you know, 10th is certainly better than worse. No one wants to be at the top of that list. But still a lot of places in the country are doing better. Who was #1? Michael Brown asks. Flint, Michigan was worst for child poverty. I'll read them out to you. I know I'm going to go through this fast. We have Flint, Michigan, Gary, Indiana, Albany, Georgia, Detroit, Michigan, Cleveland, Ohio, Albany, New York. So we have Albany, Georgia, and Albany, New York here. Lakewood, New Jersey, Madera, California, Hartford, Connecticut, and then Canton. Youngstown is not popping out at me right now, but the Center for Community Solutions will be doing much more with this data, and we'll be writing about it extensively over the course of the next couple of months. We will also have even more reliable estimates that come out for cities of any size in December when we get the 5-year estimates from the U.S. Census Bureau's American Community Survey. All right. we have made it just about to our time. We have gone through a whirlwind of a huge amount of information that we've shared with you today. As we've mentioned several times, the recording will be available later today or tomorrow morning. Please visit the website of Stark Community Foundation and United Way of Greater Stark County to view the full report. And let me thank each and every one of you so much for spending part of your afternoon with us today. We are delighted to see the interest in this information. And any of our organizations are available. Please feel welcome to reach out if you have further questions, or tell us how you're using this information in your work. We always love to hear that. So thank you again for your time today. Please keep an eye on your email for a follow-up, and we'll talk again soon. Thank you.